Il y a des gens qui le rejettent parce qu'ils ont les pieds déformés, bien sûr. Mais nous ne pouvons pas les rejeter parce que ça nous appartient. Supposons que vous arrivez à arranger les pieds de nos enfants tout de suite là. Vous, vraiment, je ne sais pas ce que nous allons vous dire. Il faut qu'on vous fasse de bénédictions. Ça c'est trop pour nous. Ça c'est trop pour nous.
One of the staff here on the ship came up to me and showed me this picture of the twins, and it just really touched my heart. And I knew at that point the surgery schedule was filling up very quickly, and so at that point I was disappointed because I knew the chances of them getting fit in was very small.
Ini baru kontak bertemu family yo kolom kola nakamali. Wala tuota mpaka itu. Osare mumutanyi de. Parce ma père muna muni. Kuyeni ba simple pauvre na namura muna kamtema muna na ndom.
When they came in, they were like the typical little kid coming to the ship for the first time, and especially being so young, they were very serious, very quiet, trying to take in this new environment. It's probably the first time they've been on a ship or been in a hospital like this, and so they were just very, very wary of us and very cautious. They had got room for them to have their surgeries, and it was actually the very last day of orthopedic surgery that the twins got their operation on the same day.
Bye, Papi.
He was in roughly that position. And we snipped the bone over here, and then we're pushing him over into that position afterwards.
Over the weeks, there was an incredible transformation. They started to really warm up to us, and I think when they felt the love and the care that we had for them, they built a trusting relationship that they started to interact just like any other little boys would do.
Post-op, we start with just standing, getting them used to feeling on their legs. I mean, you can imagine if your legs are like this and then they're like this, it changes your center of balance. So it's actually quite difficult for these kids to stand with two casts without holding on to anything. So we start with them either holding a chair, or for the twins we had walkers for them.
Usually they're up walking in 3 or 4 days, and they're out of the cast in 6 to 8 weeks.
Yay! How does it feel? Ask him how it feels.
Tobara ya like mera so many call my manga carry continue. E mali ngera deni. Nge mali ngera so call kale malima. Ala ko raka.
My hopes for them is just that they could grow up and have fulfilling lives and be able to go to school and not suffer the rejection and ridicule that so many children face when they have this condition.
It kind of breaks your heart to know that something so simple that could make a difference is just not available to the people. A lot of the things we do, they're not very complicated. They're just very basic orthopedic procedures, but they do such an amazing job in changing the patient's life.
Merci. Opa walikipa mobile yakali. Opa